Do you look at the glass as half full or half empty? Doctors say people who are more optimistic may actually reduce their risk for heart disease. Here's Dr. Timothy Johnson with more on this report.
Keeping a positive attitude may be able to reduce your risk of dying from heart disease. Researchers from Duke University followed more than 2,800 patients with heart problems and found that optimists were half as likely to die over the course of the study. The finding held true even after doctors accounted for other factors, such as the severity of the patient's illness, their age, and depression levels. Experts have many theories about why optimism may contribute to heart health. Studies show that optimists tend to take better care of themselves. They are more likely to take their heart medications as prescribed and to follow doctors' orders about exercising and eating a healthy diet. Another possibility is that pessimists have more stress, which can cause inflammation in the bloodstream and increase heart risk. While optimism is a trait often present from birth, experts say people can improve their well-being with positive thinking by counting their blessings, always hoping for the best, and not dwelling on negative emotions. With this Medical Minute, I'm Dr. Timothy Johnson.
Joining us today to give us more insight on why having a positive outlook can help your heart is Dr. Catherine Muller, a psychologist at the Montefiore Medical Center in New York City. Welcome, Dr. Muller.
Thank you. Good morning.
Well, we know that people who have a positive outlook have an innate advantage, but how can we help people who don't have that outlook to start with?
Well, the good news is that we can actually work on that. We try to help people who may not be optimists begin to think and act a bit more like an optimist. We can coach them to actually look at the way they're thinking and try to balance it, to see not just the negatives, but the positives and even the neutral things within the way they're thinking.
So what kind of tools can we offer them? Is there a general set of tools that we can say, improve your light or put yourself in a certain surrounding? Are there specific tools that we can offer them?
There are. Many therapists like myself will offer people something called cognitive behavioral therapy. This is something that people can also do on their own. Essentially, what this is looking at your thoughts and trying to balance them out by using facts and information. In addition, we coach people to start acting like an optimist. An optimist may take better care of themselves, they may get exercise, change their eating habits, and if someone just starts doing that, acting as if, they might actually find that they start to feel better as well.
There are some people who I find just sort of feed off being negative, and I find that sort of gives them their energy. Is there a balance that we can offer them to help them flip that switch? Are there specific things in that sense?
I think so. I think they're similar, helping the person look at their environment, figuring out what makes them feel good. So even if their tendency is to be negative, they can still be shaping their environment. For example, things that they enjoy like movies, music, books, making sure they have enough of those things in their life to balance out that negative tendency. So that would be one way we could help them.
Okay, because I find that there are people who, when they're negative, it's almost like they're afraid to be optimistic that it'll go wrong, that even the idea of being optimistic is negative.
No, that's a great point. A lot of people do that. I think what we try to do there is help them see that has this negative perspective actually worked? If we look at evidence from their lives, how they've lived, their successes, other things there, to help them see that they probably have done better than they think, and there might be some positive outcomes that they're ignoring.
And if we take the optimist, are there things that we can offer them to help them be aware of how their optimism is part of their success and part of their overall health, and help them actually excel in those ways and stay even more healthy?
Absolutely. I think starting by talking about it like we are today, helping them see that their coping style, their positive attitude is actually quite healthy, and nurturing that. So continuing to do those healthy things like taking care of yourself and thinking about the situations in your life in a balanced way to sort of boost what they're already doing naturally.
Is there an emergency kit that we can come up with to say that if you're going to be put into a situation, whether it's a family event or a procedure, that you can actually put these things together to help yourself be more optimistic in those cases?
I think so. I think what we can do is sometimes come up with what we'd call a coping strategy, or even a coping card, a little index card where you have this information, reminding yourself of how you've coped in the past and how well you've handled things in the past, so that you're not so negative or pessimistic strategic in looking at those situations. Your coping kit or your emergency kit might also include things that you know you enjoy so that you can balance out scary or negative or even upsetting things. And again, that would mean things like your favorite music, your favorite book, even things like pictures of people in your life that make you feel better, that make you feel connected.
Well, that sounds great. Thank you, Dr. Muller.
Thank you so much.